People are often at their most vulnerable when needing legal support, but also feel vulnerable when dealing with lawyers. But sometimes a small change can make a big difference. In research commissioned by the Legal Services Board, consumers with mental health problems and their carers have shared their experiences of legal services. They've also identified practical steps that lawyers can take to help meet their needs. There were a broad range of risk factors and often overlapping risk factors that contributed to individuals with mental health problems being vulnerable when seeking legal advice. They included age, low income, low literacy, inexperience with seeking legal advice, experience of relationship breakdown, physical disabilities, health problems, lone parents, carers, loss of income, release from prison, and living alone. There were two broad groups within the sample. There were those whose mental health problems created relatively low-level difficulties when engaging with legal service providers. This group described themselves as liable to feeling overwhelmed and needing more time to express themselves.
When you're feeling really vulnerable in a way, because they're like an authority, and I feel like the lesser person because I had a mother who had become like a child. I must admit, at the time, I thought I was going to have a nervous breakdown.
There were those whose mental health problems created significant issues when engaging with legal service providers. This group felt that they needed additional communication, for example, updates and repeated information, as well as an increased need for reassurance. Some also explained that there might be occasions when they would be unable to keep their emotions in check. As a whole, the sample group expressed some level of anxiety about using legal services. These anxieties were typically expressed as apprehension about the total cost likely to be incurred, not being able to understand jargon and technical legal language, and a pervading sense of feeling intimidated by legal professionals.
Because I'm not very good at always going to new places. I like to see the building. I like to know where I'm going. It was a free consultation. They would have done it over the phone if necessary.
Respondents across this sample were clear about how they would like interactions to be planned and conducted. They offered clear suggestions for best practice when offering legal services to people with mental health problems, who prioritised feeling listened to and understood, which was felt to involve actively engaging the individual, acknowledging the difficulty of their situation and responding sympathetically.
So I spent, I think, about 6 months, 7 months with Ombudsman, talking on the phone, emails backwards and forwards, and they was wonderful. It was, in a way, going through like a counselling session.
Feeling that they had understood the advice given, due to the clarity of the verbal explanation and written follow-up information, both of which should be jargon-free.
Me and my auntie were waiting to go into the courtroom, and my ex-husband's lawyer approached us with a hell of a lot of paperwork that was written posh-wordly. It would take me ages to read through it.
Feeling comfortable to ask questions or ask for information to be repeated. And, if disclosed, adapting the interaction to support individuals with symptoms.
Because I didn't have face-to-face meetings, it was over the phone meetings, which I thought as well at the time was great for me because of not having the time to get there, and I was feeling quite an anxious and stressed person as well with everything going on.
Continuity of personnel was also much valued.
And when I phoned up and they went, sorry, he's out of the office for 2 weeks, I was going to have a meltdown. I thought, you can't do this to me. I've been on the phone and emailing you for 4 months and you're now telling me he's gone away. I don't need this. I want to get this done and get this sorted.
In summary, practical steps for delivering legal services include actively engaging the individual, acknowledging difficult situations and responding sympathetically. Clear and jargon-free verbal explanations and written follow-up material. Making individuals feel comfortable to ask questions or ask for information to be repeated. Adapting interactions to support individuals with symptoms where disclosed. Continuity of personnel and transparency about cost.